Happy Wednesday wellness, everybody. Rachel's mouthing so many salads.
So
we got a lot of greens in our first farmer's box. Woohoo!
Yeah, we love it.
Yay, it's the start of...
I can eat vegetables again.
You wouldn't know it's the start of summer by what we're wearing, but...
yeah, it's coming.
It's great. Produce is coming in. So pumped about it. Today we're talking about fevers. I got a fever. Yeah.
Fevers, they can be scary for parents when your kiddo gets a fever.
Oh, yeah, for sure.
Even if it's an older kiddo. Like, fevers are probably what send parents to maybe like urgent care or the hospital or even your pediatrician. Probably most.
Probably, yeah.
Oh my God, my kid has a fever. What do I do?
Yeah.
How scary.
I mean, even like it's uncomfortable. Like we all know it's uncomfortable to have a fever, and usually like we just want to be out of comfort because the comfort is like...
Yeah, the discomfort is...
Yeah.
Uncomfortable.
It's uncomfortable.
It's hard to get comfortable and rest like you need to when you
Yeah.
have a fever, when you have all those really
Exactly.
body aches
And
from
we
it.
see that as like being kind of like one of the cardinal signs of sickness too,
Yeah.
right? So we're like, oh, I know I'm sick, I'm running a fever and stuff. So I know my kid's sick, they're running a fever.
So what am I going to do? How am I going to make them feel better? And we usually probably run to the over-the-counter meds to decrease that fever so they feel better, but also like so you're not so scared. But like that can have its own issues with doing that.
Yes, absolutely. So we're going to talk about what a normal fever is, what an abnormal fever is, and when to kind of like when to support the fever and when to like, seek medical attention, when to go about trying to change that. So generally, when we get sick, our immune system is going to start reacting, and it's going to increase our inflammation in our body to help fight off whatever's that virus, that bacteria that's in our body. So one of those things is fever. It's like one of the kind of main...
It's like your immune system's
response.
functioning.
Yes, exactly. So a sign that your immune system is working to fight off that infection is raising the temperature. So that temperature change is going to help stop bacterial growth. It's going to help stop the reproduction of that pathogen that is invading the body. And it's also going to help increase your immune response too. So it helps bring more blood flow, more heat to the area, helps increase white blood cell use. And so it's going to help you fight off.
It's usually a good thing if you're getting
faster.
a fever when you're sick.
Yes, exactly.
Like I said, this is a good immune response.
Yeah.
It can be an issue like if you're not getting a fever, maybe to help fight off. It's probably like illnesses, those colds will last longer. If we're suppressing the fever a lot during an illness.
So like Dr. Rachel said, sometimes we run straight to like over-the-counter meds like Tylenol, ibuprofen, that kind of stuff to help reduce those fevers, again, because it's uncomfortable. But then what we're doing is we're suppressing our body's natural immune response.
Yes.
Which can be detrimental then in the long run because then our body's not learning how to fight off bacteria and stuff too.
Now we have a suppressed immune response
Yes.
when something happens.
Exactly. Yeah. So like she said, then if we're getting sick and we're not having a fever, that can also be a sign of dysregulation. We talk about sympathetic and parasympathetic tone. If our body is in fight or flight, we're not prioritizing our immune response, right? We're trying to get away from a tiger. We're trying to get away from immediate danger, not maybe something that's been accumulating in our body. So that's
a fever's important. Like if my kids are sick, it is a bummer when they have a fever because they're usually like fussy.
Yeah.
But you know what? They're also like lethargic, right? They'll lay around more. Like if your body's, you'll lay around more, and that's not a bad thing for them to like rest if they'll still drink water or have fluid.
Your body's literally telling you like, look,
Slow
we're
down.
working on overdrive. You need to rest. We're trying to detox your body. You get the shivers or you get like kind of because you want to wrap in the blanket, you know, your body wants to increase that body temperature, and those are all really good things.
Those are all good things, and you want them, and I'm like, great, their body is really fighting this. That's what I always say, like, okay, great, their body's fighting this, and if you go to those over-counter meds every single time, the moment they get a fever, it is, you know what? They think they feel fine and they run around then. So it is just going to take longer to get over that.
It prolongs the illness.
Because they're not resting.
Anymore.
Yeah,
so if we can, especially like in those early couple of years, while the immune system's really learning, helping support the body kind of naturally, helping support like toddlers and stuff, and young kids, giving them like bone broth, giving them like warm, chicken noodle soup, right? Giving them like good, like supportive things that are also going to like help raise body temperature, help their body just like rest and get through it. They're going to clear the illness faster. They're going to clear it a lot faster when they get it again. And they'll clear things sooner like later. Like I told a mom today, she was like, I don't think he's been sick since he's been getting adjusted. I was like, that's awesome. She was like, besides, one little thing, but he got through it really quick. And I said, that's the point. Like, we're going to get sick. That's the immune upgrade. Like, we need that. But we need to be able to clear it. We need to be able to
You don't want to be sick
for
weeks at a time.
Exactly.
Also, like, you don't want a low-grade fever for, like, multiple days either.
Yeah.
Like, that's probably not normal. You kind of want to spike that fever, hopefully get over it in a day or two.
Yes. And, rest a lot, and then get through it. Yeah. So let's talk about when fevers are abnormal. If we have a really prolonged low-grade fever, that means our body, it's like, that's a sign of immune system, nervous system dysregulation too. Like, we're having a hard time getting kind of that peak and we're fighting it off for longer. Maybe we just have kind of this recurrent infection that is laying dormant and it's just not clearing. So then we really need to support the body too in that way. Or if we have a really high fever, anything over 102.2, that is more important. And that is like our body is raising the temperature too much. It could be trying to fight something that's really aggressive, and then we need to
especially from like 3 to 6 months, and if it's lasting for like multiple days. Call your pediatrician and be like, hey, most of them, I feel, most these days are like, let that, fevers aren't bad. Like most things I've been seeing that they're realizing that too. Like write it down if you can, like with your kiddos. But if they're like super lethargic, like can't get out of bed, they're having difficulty breathing, like severe headache, neck stiffness, like refusing to drink. Rashes. I mean, rashes happen. Those are common also in viral infections with kids. But it won't go away. And those are
things to get checked out. Yeah, exactly.
Things you can help with it to help a fever. Hydration, electrolyte drinks, like you said. Bone broth.
Warm drinks.
I don't know, cooling cloths, those sort of things. Also adjustments. Like, I know your kiddo's sick and you're like, I don't want to bring them in. I don't care if you bring. I'm not worried about it. It's like one of the best things you can do. I have a fever. I want an adjustment. My kids have a fever. It is the first thing I do.
That's also like the thing that I feel like has helped my fever break the soonest. Is like when I'm sick and I'm like, okay, my body's going through this, the best thing I can do is support it neurologically. When I get adjusted, usually it can break pretty quickly after that. And that is like, I'm not giving it Tylenol, I'm not suppressing the fever. I'm letting my body do what it needs to do as quick as possible.
When your body's sick, like you need to be, like your body is in a state of like stress. It's like, oh God, it's like the most time you need an adjustment. So especially, like I get it, you don't want your kids out of the house but it's okay too. Like we'll tell you if it's okay or not to bring them in if you call. Like if you're like, I heard this was good for it. Yeah, it is.
It is. Yeah, and we'll schedule them when there aren't other people here. We'll adjust them in the back room, which is the room we're in right now. But we can. I mean, we can adapt and make it, and like we'll sanitize and clean after too. But because we want to keep other people from getting it. But it is really important to get adjusted when you're
having fever, when you're having ear. Like I just had a patient calling, my kid has an ear infection. I gotta cancel. I was like, that's like the worst time to cancel.
Like let's get that thing draining. Let's get that. Let's support that nervous system.
Or we're sick. I'm like, okay. Also, we talk about this multiple times on here. I know this is just kind of a fever talk, but if we're going into illness, like kids get so dysregulated after being sick. It's like they almost need more adjustment. So get them in like maybe while at the start of it so we can help them through it. And then hopefully they don't get as dysregulated after.
Exactly. And I think part of that too is like the over-the-counter meds can be really dysregulating to the nervous system too, especially kids that are like more sensory, more hypersensitive are not going to respond as well sometimes, to the, to the just, what's in those meds. So,
So, if you have a kid that's sick all the time, I guess I'd be like, if there's something different I want to try, you should get him in.
Or that prolonged sickness. If you notice that, especially I feel like this past winter, we had a lot of illnesses going around and stuff, and it was just like,
even this spring, we've heard a lot of like people like sick again.
Well, the temperature dropped like 30 degrees. So that's it.
So we always offer, if you haven't been in, if you've seen this video, you're like, oh, I want to try chiropractic care, half off your first exam.
Yep, exactly. If you haven't been in a while, give us a call. We'd love to see you again. Even if you're just like, I just want to get my kid in for a couple of adjustments, they can't clear this thing. Do it. Like, we're here to support you. We're not going to make you feel guilty about it at all. That is not what we're about.
Also, if you're a parent who's always like jumped to the like, I'm going to give him Tylenol, I'm going to ibuprofen, maybe now you'll be like, okay, let me wait. Like, even if you just wait a few hours and see how they're doing, instead of doing it the moment you see it, that's going to just help that much more for their body to keep that fever for a little bit longer. So,
okay. All right.
Have a great Wednesday.
Viva. I don't know.
Viva. Viva.